Apart from the obvious role of being a clinician, which I fulfil sort of 2 to 3 days a week, my other role is to set the culture in the practice. It's to make sure that the experience that people get when they come into the practice is what we promise and what we would expect them to get. When we were setting up the practice and thinking of names, and there were millions of choices that we could have, we set on the option of the Campbell Clinic because I wanted to take responsibility overall for what happens. The key ethos in the practice is quite simple. We developed this over a long period of time, but we nailed it down to something very simple. So we try to look after everybody in the practice as though they were a member of our own family. We use that as a test throughout the practice. If we encounter difficult circumstances or difficult decisions, then we always apply the member of the family test. So we would pigeonhole someone into a bracket as if they were a brother or a sister or a father or a mother, and then try to decide what we would do if they were in our family. And we use that for our patient tests, we use it when we deal with suppliers, we use it when we deal with staff. It's how I would want to work if I was in someone else's business, so that's why we decided we wanted to have a business with that culture. We provide almost everything that's available in dentistry. There are very few treatments in dentistry that we don't have the ability to provide within the practice, and that was really the dream I wanted to achieve when the practice was set up. I would like the patients that come to see us to be able to come to a one-stop shop where they don't have to go off-site for anything else, and we've invested really heavily in technology, equipment, staff and clinicians to make sure that apart from the very bizarre circumstances, we can provide pretty much everything that patients need in-house in the practice. We can provide restorative dentistry for crown and bridges, orthodontics for braces, root canal fillings, all at a specialist level. We can provide sedation, three-dimensional X-ray imaging, computer-guided planning. We even have our own laboratory set up in the practice so that the vast majority of our dental manufacturing work can be done on site. It's something that we're really proud of and that we think is very special and really quite unique. We also have a CT machine in our own practice called a cone beam CT, which allows us to scan patients for an X-ray format in 3 dimensions, and then to take our computer technology and to plan dental implant cases with the utmost precision and safety to allow us to visualise things before we even touch a patient. We're one of the leading practices in the United Kingdom with this technology, and with our CAD/CAM and computer technology in the practice, patients can visualise the results before they start and have the ability to see how their surgery would be carried out.